Hello, hello. Good afternoon, everyone. Thank you so much for joining us here today. My name is Aurora Grant-Wingate, and I work for the National Association of Community Health Workers, or NACHW, as their member and partner engagement manager. And I'm so excited today to get to be emceeing our webinar around tools and strategies for adult vaccination. Before we get started today, as folks are sort of coming on the webinar, I'm going to give us a little bit of an introduction to what we're going to do today, and then talk a little bit about NACHW. First, in a moment, we're going to get going with sort of meeting our great presenters today. Before that, I'm actually going to give a very brief overview of NACHW and some of our past COVID work. And then I'm also going to hand it over to them to talk a little bit about the project the CHWs worked on us with, which is the ASTHO Adult Immunization Initiative. They're also going to come on and share some of their experience during COVID-19 and some stories around talking to community members about vaccination. We're going to talk a little bit about some tools that we developed together throughout this project. And we also have some great songs and videos that we hope folks can take back to their communities from El Sol Community Center. And then as time permits, we're excited and hoping to have some question and answers. While we're getting started here today, please feel free to introduce yourselves and ask questions in the chat, as well as network and get to know each other. We always love to see if folks have what states folks are from, if folks are CHWs. So feel free to use that chat. So to get us started today, I'm going to talk a little bit just briefly about NACHW. So first and foremost, NACHW is an organization founded by and for community health workers. Community health workers are trusted messengers with close ties to community members. We support the APHA definition of community health workers, and we also, as an organization, really want to lift up the diversity and voices and experiences of community health workers from the past, present, and future. So NACHW is still a young organization. We are founded in April 2019 after many years of planning and organizing by community health workers and allies across the United States, looking to see community health workers united nationally to support communities in achieving health, equity, and social justice. Since we are a young organization, a lot of our work has happened within the throes of the COVID-19 pandemic. And through that, we have seen a real unprecedented sort of interest in public health and community health workers. Throughout this time, we have been able to really research and keep tabs on the national landscape and how community health workers have been involved or have not been invited to be involved in certain federal initiatives. And here on screen, you can just see some of the recommendations that came down from the Biden administration, many of which did cite community health workers as an essential part of COVID-19 response and pandemic readiness more broadly. And with that, I am thrilled to pass it over to our team of community health workers, who's going to be presenting some today. And let's see, Harrietta, would you like to start off our introductions?
Sure. Welcome, everyone. It's great to see everybody here. My name is Harrittia Harper, and I currently work at Morehouse School of Medicine within family medicine in the Innovation Learning Lab, and I'm one of the program coordinators here. Briefly, I have over 20 years of collaborating closely with nonprofit organizations, forging partnership, mobilizing resources to address the unique health challenges that we all face in the vulnerable communities. And I've worked to advocate for equitable healthcare policies and to ensure that, populations have access to quality healthcare services.
Thank you so much, Harrietta. Patricia, would you like to go next?
Sure. My name is Patricia Wilson. I am from Wisconsin. I serve as the Vaccine Outreach Coordinator, Regional Coordinator for Wisconsin Health Literacy. I oversee 21 community organizations with a subgrant on vaccine education. I also have currently serving as a NACHW Community Health Worker Ambassador. My mission is to make sure that community health workers are at the table at all major decision-making and all community events. Right now, I am traveling to La Crosse, which is 200 miles away, to be on a panel to present about food insecurity, something that is really dear to my heart. I also serve on the Wisconsin Public Health Association as a new membership chair, as well as a couple of other Wisconsin foundations. It's very important that we as CHWs have a seat around the table when the decision-making is being made. So that is my mission.
Thank you so much, Patricia, and thank you for being here today while you are in transit. Nache't, would you like to go next?
Good morning. Hello, everyone. Glad to see you all here. My name is Nache't Brown. I am a successful mother of 4 daughters and 1 son, and I also have 4 grandchildren. I currently work as a facilitator for the training center at ASTHO Educational Center in San Bernardino, California, really looking to enhance the skill set that community health workers already have. Because we were born, not made, right? And so really loving the idea of meeting champions for change while in the training center, and then continuing communication with the alumni as we see them in the community doing the work. So really happy to be a member of NACHW and to be with you all here today.
Thank you so much. And Brandy, would you like to go next?
Yes, my name is Brandy Fields. I am located in McCroy, Arkansas. I am a mother of 5, and my main goal as a community health worker is to ensure quality health care. But my biggest thing I've done here lately is helping families get their electric bill paid. That has been the biggest thing that I have done in the last 2 months. So, and it makes you feel good.
Thank you, Brandy. And
You're welcome.
Falissa Miller is not able to join us today. She had a conflict come up, but I want to give her a thank you for also being part of our work with ASTHO and really helping shape the tools that we created and the wonderful feedback that we have received. Let's see, and next, I am gonna hand it off to Harrietta to talk a little bit about the ASTHO Adult Immunization Initiative.
I was muted. I'm sorry. How we actually are increasing equity in adult immunization. And so the Association of State and Territorial Health Officials has launched a new national program reducing disparities in vaccination rate to advance health equity and reduce the burden of vaccines in preventable diseases among adults. ASTHO, alongside the National Community Action Partnership, have worked to engage a network of local community action teams in 5 geographical areas, implementing and focusing on advancing equity in distribution and or uptake of immunizations amongst ethnic minority groups and rural population. My own screen was blocking my slides, so I apologize.
No worries. And Nache't, do you want to talk a little bit about the partnership between NACHW and ASTHO?
Absolutely. Partnership with NACHW and the CHW. So as a part of their process, ASTHO established a partnership with the National Association of Community Health Workers, NACHW, to recruit and lead a community health worker council to give those recommendations and best practices for engaging community members in vaccination in ASTHO's 5 geographic areas. So first and foremost, when NACHW does something, makes a statement, it's not just NACHW making the statement, right? They are including all of us. So NACHW calls on public and private institutions to really respect, protect, sustain, and partner with CHWs like myself. So in those 5 geographical areas, councils debriefed weekly, bi-weekly, and monthly to really share the voice of the community. And we have organized together for more than about a year and a half to really hyper-focus on our experience with the community during pandemic. So focus groups were held with prominent doctors, organizations like CAP, Community Action Partnership, Kern County, whoop, whoop, churches, and pastors to outline those best practices to engage the community, like webinars, events, pop-up clinics. We also enriched flyers to include multiple languages to invite the community to ask questions, share their comments and concerns, but mostly to be vigilant, right? We also created a safe space for the community to elaborate how they felt about vaccinations and our future going forward in the community. So we used common ground examples like those testimonies to bridge communication. We empowered community members to receive education on vaccinations by hearing from those doctors, and also providing that space where they could see someone else get vaccinated and actually see the results of a post-vaccination. So for me, I like to share my testimony as a mother. I was very fearful of getting the vaccination, but my daughter was looking forward in her educational goals and she was going to grad school. So she says, Mom, in order for me to get accepted into grad school, I have to take the vaccination. So I said, before you put it in you, I'm going to put it in me. So that's a real testimony. But being able to educate myself and being part of those webinars to really, it really grounded me to know that I could feel that I was educated about the vaccination and move on. So we're very thankful for ASTHO looking to NACHW to partner with community health workers. And I really had a great time partnering with NACHW to do so. So yes, moving right along. So we use the arts to promote health, right? That's a whimsical tool that we can really use to advance promoting health in our community. The arts are commonly used to provoke thought, emotion, dialogue, and action about a wide range of topics. So pertaining to COVID-19, the arts can support the expression of people's most important dreams, important hopes, including the dreams of health, peace, and justice for our future within our communities. Our most cherished director, Mr. Alex Fajardo, invited me to a planning meeting, you all. During this meeting, he asked me what the community was talking about. At that time, I was a community health and education worker working in the field, knocking on doors of students who were more than 10% absent. So I would be having different interviews and one-on-ones with parents, right? So I remember on March 17th, when we were all told that our role and our competencies were essential, right? We became those essential workers. We hit the ground running to deliver food, sometimes picking up a food stamp card on a tree and going and shopping for families and bringing that back, listening to their concerns about the elderly, how they were going to isolate their family of 5 in a 2-bedroom, the fears of how to live on, right? Lack of food and finances. So I just kind of sat back and he says, so how could we possibly make a song out of this? Well, I thought about everything that people were saying, and I said, where do we go from here? How do we begin to heal? And with that, guys, they made a song. They actually made 2, one in English and one in Spanish. And we'll share that with you just now.
time to heal, time to move on, time to build. Juntos, adelante, no fear. That's where we go from here. Hey, time to live, time to live, time to heal, time to heal, time to move on, time to build. Let's juntos, adelante, no fear. That's where we go from here. Go from here. Hey. Face the facts, here's the reality. The virus hit hardest in all communities. Black and brown, from my town to your town. If we work together, we can turn the tide around. Now I'm in line for the vaccine. I think of everything I've seen, and I don't wanna lose one more. I do it for the ones I love, that's for sure. We're in this together, it's now or never. Work towards change for the better. For the better. Yeah, same struggle and the same dream. Hermano, you are my team. You know what time it is. Time to live, time to live, time to heal, time to heal, time to move on, time to build. Yeah, juntos, adelante, no fear. That's where we go from here. Where we go. Time to live, time to live, time to heal, time to heal, time to move on, time to build. Yeah, juntos, adelante, no fear. That's where we go from here. Let's go. Hey. So many questions for what's next. Yeah. So many options for what's best. Yeah. From social distance and mass protection to understanding the vaccination. They say recovery's a long road. Yeah. Let's go hand in hand so we don't journey alone. Right. Rebuild the community. We're looking for healing as the fall from dark days is finally clearing. Clear it out, clear it out, clear it out, clear it out. Hey. Now the world opens up again. Let's all be accountable to family and friends. Let's make a new normal, a healthy reality. Physical, emotional, mental clarity. Think about all we endured this year, but we still had hope to overcome fear. As our smiles return and we wipe the tears, the question is, where do we go from here? Time to live, time to live, time to heal, time to heal, time to move on, time to build. Yeah, juntos, adelante, no fear. That's where we go from here. Hey. Time to live, time to live, time to heal, time to heal, time to move on, time to build. Hey. Juntos, adelante, no fear. That's where we go from here. You know what time it is. Let's do it! Time to live, time to live, time to heal, time to heal, time to move on.
Hey, so that's the English version. Can't you just hear that in a grocery store somewhere? You shopping for food? Now let's get into the Spanish version.
Yo me sentía bien enfermo con tos y cansancio y temperatura. Pensé será el COVID, el coronavirus. Me hice la prueba para salir de dudas. Decidí quedarme en casa, pues si voy al jale, contagio la raza. Si tú andas enfermo, ahí te va un consejo. Ve y hazte la prueba que el virus no es juego. ¿Y qué dijo? Pues ya me agarró. No cantes victoria, COVID-19. Yo me cuido y la raza ya habló. Haremos historia. Juntos sí se puede. Y a cuidarnos todos, mi gente. ¡Ánimo! Si no quieres contagiarte, usa el cubrebocas. Si sales de casa, mantén la distancia, que el virus se pasa cuando alguien te tose o no más si te haga. Lávate muy bien las manos, mantén todo limpio. No toques tus ojos, que ahí pasa el virus. Carnal, ahí te digo, cuidémonos, raza, que de esta salimos. ¿Y qué dijo? Pues ya me agarró. No cantes victoria, COVID-19. Yo me cuido y la raza ya habló. Haremos historia. Juntos sí se puede. Y usemos cubrebocas, mi raza. Pa' este virus ya hay vacuna, no te cuesta nada y es rete segura. Cuando sea mi turno, yo le pondré el brazo. Por salvar mi vida me aguanto el pinchazo. Si te llaman del estado y tal vez te preguntan con quién has estado, contesta tranquilo, están averiguando por dónde anda el virus ya quien ha contagiado. ¿Y qué dijo? Pues ya me agarró. No cantes victoria, COVID-19. Yo me cuido y la raza ya habló. Haremos historia. Hagamos caso. Juntos sí se puede. Sí, señor. Ahí quedó.
Bravo. Yes, yes. So please use those songs at your meetings, your town hall meetings, your key informant interviews, your collaboration, your network. Use them wherever you need to. Will really strengthen building those relationships and maintaining them. So we also thought about the children as well, right? So we thought about the children and what could we do when we go to the events. We could set up a booth, but we wanted to do something else, right? So originally we created a movie that turned into a comic strip. So with the movie, we first, we created a play. So we did the play, we would go to different events and we would actually act it out right there with all the children. And then we got so much positive feedback that we went ahead and created a movie, a comic strip that you will enjoy. So we'll play it for you now.
In 2019, a new virus arrived on Earth. It was more contagious and deadly than ever expected. It soon began to spread all around the world. To stop the spread and protect the people, non-essential activities were paused. Theaters, playgrounds, schools, and gyms were all closed down as large gatherings were no longer safe. Luckily, our superheroes, as some have come to call them, from El Sol came to the rescue.
Dr. Brown, what are we going to do? Every day I see more and more young people in our reception area.
I know. Unfortunately, because of all the misinformation going on, many of them think they don't need a COVID-19 vaccine. They are spreading the virus amongst themselves, and those whose immune systems are not as strong are ending up in our hospital. You know what? I have an idea. I think it's time to call El Sol for support.
Thank you all for listening to our presentation. Again, we cannot emphasize enough the importance of getting vaccinated, especially right now with all the new variants that are emerging.
Yes, Victoria is right. These new variants are more contagious than the original, and it's going to take all of us getting vaccinated to stop the spread.
I can handle it from here, Danny. Go ahead.
Thank you, Victoria. Hi, Dr. Brown. What's going on?
We have a problem, Captain. Our hospital is filling up with unvaccinated young adults. It seems like many of them are deciding not to get vaccinated. Can you help figure out what is going on? Many of them are coming from the downtown area. I believe coronavirus is around there. Please find him, Captain.
Don't worry, Doctor. I will head out and find him. You keep helping those young adults in your hospital and leave the rest to me.
Go, Danny. Go get him.
Oh, these weaklings are unvaccinated. Let's go get them.
Yes, let's get those kids.
Kids, Rona is here. Hide, go!
Romy, he's here. We need backup. Assemble the promotores.
Not you again. Which variant are you now?
I'm the OG, baby. Look who we have here. It's Captain Empath in cartoon form.
You, the OG. Sure.
Shush, variants. Don't make me look bad in front of the captain.
Answer me, Rona. What do you want with them?
I don't want anything from them. I'm just here to tell them the truth about the vaccines.
What truth?
That they are not needed.
That is not true, and you know it.
The vaccines are dangerous. It'll make them sick and weak.
That's not the full truth. You know that if they do get sick after a vaccine, it just means that the vaccine is helping their bodies build protection.
What's screaming on your...
That may be true.
Anyway.
Kids don't even need the vaccine. They are young and strong. I would never hurt them. I'm just a weak little...
So for the purposes of time, we won't play the whole thing, but as you can see, it can break up a negativity about a COVID-19. I was just overjoyed at being able to actually beat COVID up in the park, having that opportunity. So yes, I saw a lot of you putting responses in the chat that you would use this. Please do. Please feel free to use it, as we will put those links in the chat so that you can have access to them going forward. We thank the media team at El Sol for putting this together. Absolutely. And thank you for letting me share. I had always wanted to be a doctor when I was a little girl, and I was able to play a doctor in this. So I really appreciate that opportunity.
Thank you. Sorry about that, folks. And now I'd like to hand it over to Patricia to talk a little bit about her experience talking about vaccines with her community.
So as a vaccine outreach coordinator in Wisconsin, we know that COVID has the same symptoms, the same effect all around the nation. I was honored to actually work with counties in Alabama and Georgia to help them decrease their vaccine hesitancy. We implemented programs like Flag on the Field for football season. We did Take the Shot for shots for basketball season. We even developed some Braille resources for COVID. The pictures of that I'm showing, that's showing in front of you, the lady on the left in the pink shirt, she's actually the lady from the CDC. And the one on the right in the pink blazer, she's actually the National CAP Agency Director. So we came together in Atlanta, Georgia for a big conference to talk about what the CAP agencies, what they learned, what actually did hinder them, what obstacles they faced. And we brainstormed for 45 minutes, each CAP agency. We did a round robin and everyone gave suggestions on some of the obstacles that
Patricia, I think you might have accidentally muted yourself. Thank you. There you go.
Okay, I'm sorry. The picture behind me is the bridge. We as CHWs, we are the bridge. The water are all the barriers that face the community. So I always like to show my background as being the bridge, because as CHWs, we are the bridge. So I had the honor of working with Alabama and Georgia, and it was fabulous. All the brainstorming, we worked with churches, we worked with community organizations. We went to football games, little league baseball games, anywhere that we could spread the message, even around holidays. For Valentine's Day, it was take the shot to protect your lovers. So we implemented things that the community was interested in, and we tailored a vaccine message around that. It was a fabulous experience. I still attend some of the meetings for the Alabama and Georgia counties. Thank you, NACHW, for allowing me to be a part of that. In Wisconsin, we developed a toolkit, and you'll see was adapted by NACHW for your resources. It was tweaked. Also, we've done things like we developed tools like data tools that I shared with Alabama and Georgia that they can use, surveys. And it was just a unique experience to see that each state was still facing the things that we were facing as well. So we supported each other on those issues. And together we tackled COVID. I want to say we keep COVID, but in Atlanta, Georgia, and Wisconsin.
Thank you, Patricia. I also want to invite onto the mic Brandy or Harrietta, if you guys want to share any instances or examples of talking to your communities about COVID.
I just want to quickly reiterate what Patricia said. I too was on her team here in Atlanta, and I was able to engage Morehouse School of Medicine into helping us out on some of the events that actually took place. So I was involved with also getting additional partnerships and collaboration for the basketball shots for shots. And I'm still doing things with that team right now, Patricia. There was just a meeting on yesterday, and they are trying to make sure that people that are homebound, that just can't get out, are also getting vaccinated. So the work that we've done initially continues. And so that's the beauty of this project. It is still going on. We're still engaged in our community, and it has been an awesome experience and something that I just, look forward to keep doing every day, serving my community.
Thank you, Harrietta. And Brandy, anything else you'd like to add about sort of personal experiences working with community?
Yes, I have been working with Arkansas Minority Health, and we go all over the whole entire state of Arkansas doing free health screenings and COVID screenings. And still to this day, that's our biggest goal, is to make sure everyone is vaccinated. And like she spoke earlier on the ones that are home bodies, like the ones that really need to be vaccinated, that has been one of our biggest pushes right now. And other than that, I think that about covers it.
Thank you, Brandy. We also want to talk a little bit today about some of the resources that some of the NACHW staff, in partnership with these wonderful CHWs, came up with through what they learned throughout the project. So I'm going to hand it back over to Brandy to talk about a couple of our products.
I'm actually driving at the moment, so I'm trying to get to where I can actually read it.
And that's okay, Brandy, if you want to stay safe and I can sort of start us off. So one of the first things that we created was through all the learnings from the community health workers. They were reporting back to us every month, sort of what they were learning and talking about in these advisory committees. We came up with a couple of key ways that community health workers can work to combat vaccine hesitancy, along with some key resources. The first was talking about, really focusing on removing social determinant of health barriers, making sure that folks have access to safe and healthy food and housing, as well as insurance if possible, using resources like foodfinder.us and medicaid.gov, as well as Find Help, to make sure folks have those basic needs covered, which can really help make folks more willing to talk about vaccination. And we also want to make sure that folks have the facts at hand about vaccination. There's been a lot of misinformation, but also just fear around the vaccine. So we want to make sure that folks know what can and cannot happen when you get the vaccine. And there are great resources at the CDC and other websites as well. And we also want to encourage CHWs to tell your story. I think a lot of our CHWs today did just that, talking about sort of your own personal journey about why you decided to get the vaccine. And again, there are some great resources out there, such as Greater Than COVID, The Conversation, and We Can Do This. And then, of course, just some of the practical help around sort of where and when of getting a vaccine. Sometimes even that basic barrier of sort of, where do I go? Where can I get it for free? Can be daunting for folks. So really helping folks figure out when and where they're going to get the vaccine can sometimes be the difference in getting folks to those appointments. And then on the back of this handout, we just have a couple other tips and tricks for helping to prevent COVID. Such as using rapid tests, wearing masks and avoiding crowded places when possible, letting fresh air into your homes, making sure you're in well-ventilated spaces can also be really helpful. And then, of course, going back to basics like hand washing. Make sure after you're out in the bath, especially kids, there have been some recent articles about how many COVID infections start with kids, and making sure when they come home from school to wash their hands and all of that. So we have this flyer available to download on our website, and we'll make sure to share those links in the chat as well as send those out afterwards. Our next—
Thank you so much for helping me.
Thank you, Brandy. Go ahead. Are you able to share now, Brandy? Are you still driving?
I'm still driving. I'm sorry. I thought you was done talking.
No worries. I want to give a big shout out to Patricia for recommending this product. This is something called Live Binder, which, similar to a physical binder, lets you put links into a lot of great resources and sort of organize them by tabs. So this is sort of our binder of COVID resources. If you visit Live Binder, and I'll click on the link right now, this is sort of free and available to use. I'm gonna have to reshare my screen, excuse me. These are a lot of different links and resources. The first link is actually to that 2-pager where you can easily sort of download it. We're also looking to get this translated into Spanish for folks. We also, and I'll talk about this more in a minute, a quick business card, which you can use to print out, and this QR code attaches to this Live Binder. So if you don't have funding, or if folks don't respond really well to like handouts, you can also just hand out little business cards. And here in this binder, you can find all sorts of different resources. Here it connects just to NACHW's vaccine page, where you see we have the Live Binder attached, as well as things like the Vaccine Equity Resource Repository, which is a great website filled with different toolkits and events and messaging around vaccines. We also have things sorted into things like vaccine materials, if you're just looking for different handouts for community members. If we also connect to El Sol, we've got to see a bunch of El Sol's great resources here today. Also places like The Conversation, which has a lot of great videos and information about combating misinformation around COVID. What's great about the Live Binder is you can switch to different websites without having to leave this page. So it's really easy to sort of click around. Here we have some information about the new COVID boosters, and we're looking to also build this out. As many of you probably know, a brand new booster has just been approved. So we want to make sure folks have accurate information around that. We have prevention resources, some resources around COVID-19 treatments, isolation, long COVID, and more. Another great thing about this resource is that we can keep updating it and making sure it stays up to date. So this is something that we do want to offer to everyone on the call to be able to go and look at that and get some up-to-date information on COVID, and we'll continue to share that out. And again, that this business card, if you're interested in sharing the live binder, is also available to print out on our website, as well as in the live binder. And I see Jessica asked in the chat, will the link to the live binder be sent out after the call? Yes, all the links and things that we share today on the call are going to be emailed out to everyone who registers. So you can go back and use it as a reference. Before we start a Q&A, we want to end things on sort of a high note and also sort of give thanks to all the wonderful CHWs on this project and on the call today. So I again want to invite Nache't onto the mic to talk a little bit about the El Sol CHW anthem.
Okay, you all. So if we were in person, I would ask you to get up out of your seat. You know, I talk a lot about community health workers and how unique we are. We were born, not made. You know, when I was 7, I go to the 7-Eleven with my dad and I say, Dad, that guy's sitting there. He has no shoes on. He's dirty. What can we do? He said, no, don't talk to them. I said, well, Dad, one day I want to grow up and talk to the mayor. I want to sit with him and work with him about our city. So in that way, you know, we were born, not made, and we have a huge heart to work with the community. So our director, I mention him a lot because he's very, very important to me. I have a lot of passion for our director. He takes pride in diversity and inclusion. So he sought out across the United States, and at the Unity Conference, we announced all the states that took part in creating this anthem. We now have a community health worker anthem, you all. And we're going to play it for you right here. It also has some dance moves that are very unique. I would also like to invite you all to use this song and create your own choreograph to this anthem and share it on your social medias. Use the hashtag #BornNotMade, okay? Hashtag #BornNotMade, so that we can support you and like your social media outputs there. So let's see what our COVID anthem consists of.
We are working for health justice every single day. We are community health workers, born not made. We are working for health justice every single day. We are community health workers, born not made.
Here's our mission to strengthen our community, working together with love and in unity, all around the world, all around the nation, community transformation.
We are working for health justice every single day. We are community health workers, born not made.
We know firsthand what you're going through. We got lived experience, we've been there too. We got empathy, and here's the best part, we're giving it all our heart.
We are working for health justice every single day. We are community health workers, born not made.
When systems are hard to navigate, when people need someone to advocate, when we see a pattern that needs to be changed, we are community health workers, community health workers.
We are working for health justice every single day. We are community health workers, born not made. We are working for health justice every single day.
That is our anthem, you all. It has been launched nationally, and that was the English version. Let's take part in the Spanish version.
Por la salud, la equidad y la transformación, ser promotor, promotora es nuestra vocación. Por la salud, la equidad y la transformación, ser promotor, promotora es nuestra pasión. Equidad en la salud es el objetivo, con amor y con paciencia trabaja conmigo, de costa a costa, de mar a mar, transformemos la comunidad. Por la salud, la equidad y la transformación, ser promotor, promotora es nuestra vocación.
Yo te entiendo, créeme que sí, en carne propia también lo viví. Por eso hoy te doy mi comprensión y pongo el corazón, pongo el corazón.
Por la salud, la equidad y la transformación, ser promotor, promotora es nuestra vocación. Porque el sistema es difícil de navegar y la gente necesita quien los pueda apoyar. Tantas cosas que juntos podemos cambiar, por eso somos promotores, promotores. Por la salud, la equidad y la transformación, ser promotor, promotora es nuestra vocación. Por la salud, la equidad y la transformación, ser promotor, promotora es nuestra pasión.
So let's get into it, you all. We finally have a platform. We are community health workers. We're born, not made. And so I admire being a part of this team. Miss Harrietta, Miss Patricia, you guys are awesome. Miss Aurora, Miss Brandy, special thanks to Felicia. We are the ones. We are the ones and the champions for change. So I thank you for this time, and all of this information and the QR codes will be sent to you so that you can continue to spread the word. Take good care.
Thank you. We now have a couple minutes left of our webinar, and I want to invite, if folks have questions for our team here today, to please either sort of raise your hands or come off mute and ask, or drop your questions in the chat. Thank you so much to all of our community health workers. We really appreciate all your time and energy throughout this project. So I'm going to stop sharing and see if anyone has questions. We also welcome if folks have their own resources or things that they know of around COVID or vaccinations more broadly, and you would like to share those out. We also really appreciate that. Also, if folks have any stories or experience talking about vaccinations within the community, we know that now it's the fall, it's back to school season. It's also COVID, RSV, and flu season. So we want to make sure that folks are fully prepared and have all the resources they need to encourage community members to get vaccinated and to stay healthy throughout this fall and winter. Okay, it doesn't seem like folks have any questions today. I want to give one more thank you, an opportunity. If Harrietta, Nache't, Brandy, or Patricia, if you have any final thoughts that you'd like to share with the group today. Okay, then it seems like we can give folks a couple minutes back to their day. thank you so much, all of you, for taking time out of your day to come and learn about our resources and hear a little bit about the great work our CHWs have done these last few months. We appreciate all the great work you're doing in your communities. And thank you for continuing to support NACHW by coming on these webinars. We really appreciate it. Keep on the lookout. We're going to be sending more materials out throughout the COVID season to make sure folks are able to respond.
I just want to say thank you, Aurora, for doing this and putting this together for us. Thank you very much. It's been wonderful.
Thank you, Harrietta. Appreciate it.
Yes, I'm with Miss Harrietta. Thank you so much. And you can count on me anytime.
Thank you. Everyone, please have a safe and healthy rest of your day. And we will see you all soon. Thank you.